I'm Kirsty from Fit for Dogs Canine Hydrotherapy Centre here, and today we're going to be talking to Heike about acupuncture and the amazing work that she's been doing in the East Yorkshire area. So hi!
Hi, nice to see everybody.
Yeah, so tell us all about what you do.
Oh, right, okay. Well, first of all, I'm a veterinary surgeon. So I've worked for 27 years in this area, nowadays mainly doing small animals and horses. I work as a routine vet in Beverley and Hornsey. And I started specializing in acupuncture about 25 years ago now. So I've used it ever since, at first fairly reluctantly, because there was not much evidence there to support the use of acupuncture. But I did have clients asking me about it and wanting me to explore it further. So I went down that way, did a course, started using it, and over the next sort of 10, 15 years, got more and more really positive responses from it, liked how it was working, how it didn't have any side effects, how it was complementary to all the other things I was doing, and have sort of specialized in it more and more really. So I'm now doing 2 days a week, just working at the normal surgery, doing consultations, doing operations, surgery. And the other 3 days of the week, I tend to go out and do acupunctures on horses, dogs, and cats.
Excellent. Oh, that's really good. You sound very busy.
Yeah, I like to keep busy. Keeps me out of the house and keeps me getting, doing what I love doing. So.
Yeah, oh, that's really good. So let's just explain what sort of acupuncture is and, and how it works.
Right, okay. So acupuncture basically means it's using needles, putting into certain points in the animals, which are acupuncture points, which are prescribed, and we know exactly where they sit, and to a certain depth, putting these needles in, and with that, balancing the energy in the animal, reducing pain, inflammation, and making the animal feel better as well about how the pain is going. So there are different ways of looking at it. Obviously, acupuncture has been around for a very long time. It's first been described in cave paintings 3,000 years ago, but the first books were written probably about 100, 200 years before Christ, which is still books that we look at for the point description and that sort of thing. And that was more a spiritual way of looking at acupuncture. So it was used on humans. It took into consideration how they felt, and not only where the pain was, but were they hot, were they cold, did they feel sick, and that sort of thing. So it took a lot of things into consideration. And the Chinese way of looking at acupuncture is still very much based on those sort of things. Whereas in the Western world now, the acupuncture that we are now mainly using, is the Western-based acupuncture, which looks more at the way acupuncture works on the nervous system and on the inflammatory system and what it does in the brain. And those are things that we can now scientifically understand and prove as well that there is something happening there. So over the last 10, 15 years, we've got a lot more scientific evidence for how acupuncture works. Very much more difficult to prove it in the dogs, but a lot of studies are done on humans because obviously they can describe their pain much better. You have a lot more people with the same conditions, like knee arthritis or something like that. And they have got greater sort of numbers to do studies on, which is more evidence-based, really. So how does it work? Well, if you look at the sort of Chinese way, then you're balancing energies out. You're looking at different levels. You're balancing the qi, the yin and yang in the body, the positive and negative, to make the body go back to a normal balance again, get it healthy again. And you might use the same points for a dog with, say, diarrhea or constipation, because what you're trying to do is get it back to normal, whatever it has, whichever way it goes. you want it back to normal. Whereas on the sort of Western way, what we're looking at is, which is what we more can understand, is that first of all, we insert a needle and we obviously get a little local reaction there. We're making a tiny little wound in that area, say around the knee joint. It increases blood supply to the area. Like with any wound that you're getting, it increases blood supply to the area. It stimulates wound healing, so you're getting white blood cells into the area, you're getting lymph drainage into the area, which is taking some toxins away if you've got tender muscles, for example. So you're getting localized healing happening as well if you've got a damaged joint, for example. But as well, these acupuncture points are a combination of tiny little nerve endings as well as the blood vessels, the lymph vessels, and that sort of thing. So you're getting nerve information, nerve relay back down to the spinal cord and up into the brain stem, and it does all sorts of magical things in the brain. And that's been proven by studies that they've done on humans, where they did acupuncture on knee arthritis and did a brain scan at the same time. Mm-hmm. So they were looking at what brain waves were happening, where things were going off in the brain. And what they did find is that despite putting needles into this specific area, the brain actually calmed down. They expected it to spike off, pain, things going on, all sorts of things. But actually the brain went quiet and calm. And there were certain areas in the brain that respond to pain relief. And they were stimulating a lot more anti-inflammatories being produced, endorphins being produced for well-being. And with that, pain reduction happening from the brain downwards, so that the dog actually didn't feel pain as much and felt better about it, and relaxed the muscles around the joint that was damaged, relaxed the muscles in the back that's often secondarily damaged. So there are two things happening. You get something on the local area and something in the brain as well. That's sort of going on there.
Wow, that sounds amazing.
It's a very brief explanation. There's loads of chemicals involved and all sorts, but I'm not going to go into that.
No. No, that was really good. No, that's amazing. And especially as you're saying, you know, just calming and relaxing and getting that inflammation down. That's awesome.
It's very interesting when you do acupuncture on dogs, especially at the beginning when they're not very used to it, and you put the needles in. You often expect the dog to be absolutely angry about it or upset about it and that sort of thing. But actually what you find after a little while is that they calm down, that they relax, that they go to sleep even.
Yeah.
And what I often do, horses are a lot more susceptible to acupuncture than dogs. And what I often do if I get a horse that's not very nice to handle or very difficult to get needles in, I put 1 or 2 needles in, give that a couple of minutes, and it often lets me put the rest of the needles in quite nicely, because the endorphins have started to calm down, to be released from the brain, and it calms down, it relaxes, often droops its head, settles down, and you can do the rest of the acupuncture. So it just shows how quickly that actually works.
Yeah. Oh, that sounds really good. So what do you expect from your first session? So if someone was sort of like coming to you on their first sort of session, what does it sort of look like?
What does it look like? Well, first of all, what I would like to do is know what's going on. I need to have a good assessment of the animal, of what actually the problem is, and I will either, if the animal has been referred to me, we'll get the history from the previous vets, or some people come directly to me. I'll get a history at least of what's been happening, how long this has been going on, has it had surgery, has it had medication beforehand, and what they do with the animal at home, how much exercise does it do, is it a fit dog, is it a not fit dog, and then I'll examine it as well, so that I know exactly what's going on. I'll often make it walk, I might make it go up and down the steps a little bit. I will have a good feel at the different joints, so make my own diagnosis really First of all, conventionally, so I know which joint we're looking at, what might be the problem. Second of all, I'll look at it from the acupuncture points, which are tender points, which are points that are around the local area, which are further away that might be tender. Like in physiotherapy, we do use trigger points as well, that I will either, if the animal is relaxed enough, acupuncture or massage a little bit or laser a little bit while it's having its acupuncture as well. So first of all, I'll probably spend 20 minutes, half an hour going through the history, looking at the dog and making my own mind up of what I think is right for this dog. Does it need chronic medication for acupuncture? Does it need a few sessions? That sort of thing. And then we'll make a plan. And usually at the first time, I will try certainly and fit some acupuncture in as well, even if it is only a few needles, to get the dog used to it, to let the owner see how the animal copes with the acupuncture. And we'll do the main points and just see what response we're getting there.
No, that's really good. So it sounds like you have quite a long session on the first session to get all this.
Yes.
History. And so obviously if they're coming from another vet's, they need to have a consent form from that vet's with their history.
No, they don't, because obviously I'm a veterinary surgeon in my own right, so I can just take referrals directly.
Yeah.
But I would always like to work with the other vet if possible. Now, some vets are still not very keen on all these alternative complementary modalities, so they're not too keen on working. But if they do, then I will get their referral and we'll get their history and we'll send them referral reports back as well to see how we're getting on.
Yeah, no, that sounds really good. Yeah, because I know that obviously with us, we've got some clients that do both, don't they? Hydro and acupuncture, and it complements each other quite nicely. So
yes, and it is always good to know what the other one is doing and how the animal is getting on with that sort of thing.
Yeah, no, that's really good. And so what sort of conditions are best for acupuncture? So what sort of conditions do you mainly see?
Right, mainly what I see is musculoskeletal problems, which is what most people know about that you use acupuncture for, what they often have used themselves acupuncture for or have heard about it. So either chronic pain, things like osteoarthritis, hip dysplasia, elbow dysplasia, those sort of chronic problems that are causing pain in the dog, or acute problems like intervertebral disc disease in especially Dachshunds, or stifle problems like a ruptured cruciate. So I might use acupuncture as rehabilitation after they have had surgery. Or there are quite a lot of dogs that are either too old or what the owner perceives as too old to have surgery still for cruciate ligament disease, or it has underlying conditions like heart disease or liver disease and can't have surgery. And then we might use acupuncture, often in combination with hydrotherapy, to get those better again. And that might be just sort of a few short sessions, especially with intervertebral disc disease. They will either get better or they will need surgery eventually. Or in chronic conditions, we will then make a long-term plan and go forwards there. So those are the main things that I see. Back problems, anything like that to do with pain. But you can use acupuncture as well for skin diseases, itchiness, local diseases. So I often use it for if they have got lesions on their forearms, for example, that don't go away very easily. So you can use acupuncture to stop the animal feeling the necessity to lick. You can override that with acupuncture. You have to be careful, obviously, if it's a dog that's got an infected skin also, you might not want to go with needles there at all, but you then do it away from that area. You can use acupuncture for epilepsy to reduce the amount of medication the animal is on when it's not completely controlled with medication. You can use it for lung diseases, so COPD in horses, for example, obstructive pulmonary disease. They're often on steroids. They don't cope very well with steroids. Westies are the other one that have got these diseases, and you can reduce the amount of steroids you give them with giving acupuncture as well, opening up the airspace, making them breathe better, that sort of thing. They have started using acupuncture for behavioral problems, so to reduce anxiety in combination with behavioral treatments. Yeah. And I have seen a few cats for that sort of situation. Cats that I've had one cat recently that got absolutely panicky, and all it had was a really bad flea allergy, but it wouldn't come in the house anymore. It didn't want to be touched anymore. And we used laser for that one to just calm it down a little bit so they could get treatment on the cat and that sort of thing. And that worked really well. And the newest thing at the moment is, and that's getting at the moment some research done at, you've well heard of Noel Fitzpatrick. Well, he's got his surgical thing, obviously, but they do have a soft tissue surgery ward as well now, hospital, where they do a lot of cancer therapy and surgery for cancer and chemotherapy. And acupuncture is used for reducing the pain, for cancer pain, pre and post surgery, and to reduce the amount of nausea, sickness, illness, feeling sick. That's accompanies often chemotherapy as well. So they're doing trials there at the moment for that, and that seems to be very successful. So it's all sorts of conditions. In a way, the way the Chinese used to use it for everything. However, we've gone down to what we know about much more is the musculoskeletal side, and that's what it's used to mostly.
But yeah, no, that is amazing, especially like as you're talking about with like epilepsy and things like that, because you just sort of think you're going to treat that with medication, but there are some more holistic opportunities as well out there for managing those different cases, which is really good.
Yes, and I wouldn't treat an animal for epilepsy just with acupuncture, but if the seizure rate is very high or they don't cope with medication, then it's another modality to use, basically.
Yeah, because it's a combination of everything, isn't it?
Yes.
Before, it's not just one thing, it's a combination of everything, which is really nice to put it all together.
And I think that's what comes over the last few years, what hasn't been much more prevalent, that we all work together, that we use not only just medication or just hydrotherapy or just acupuncture or just homeopathy. We try and use it, or we should try and use it all together to get the best for the animal.
Yeah, definitely. Because, at the end of the day, that's what we want. We want to improve the quality of that dog's life.
Yes.
And that's our main thing. I've got a question from Jane, which I've done before. So my dog has arthritis. Would acupuncture help my dog?
Probably yes.
With arthritis.
Yes, probably yes. And it depends which joint it is and how bad it is and that sort of thing. But generally, because arthritis is an inflammatory disease, acupuncture reduces inflammation. So yes, it would probably help.
Oh, it's really good. So, my dog has a sore back. He's on medication, but would like to try something else to help him with acupuncture. So I suppose you probably go, obviously, with your history. So go on, that first consult, and then obviously get all the information together. But I suppose it's quite a general question, isn't it?
Yes, but certainly in back problems, acupuncture does help. Now, it depends where the sore back is coming from. Often sore backs are secondary to lamenesses, to certain problems in separate joints, whether it is hip joints, whether it's elbow joint, because they all make the dog walk slightly different and put pressure on the back, put pressure on the spinal cord. And with relaxing the back and maybe treating the actual joints as well, you can stretch the dog out, you make it much happier, and it works much, that actual joint can heal a little bit better and work a little bit better as well.
Mm. Yeah, no, that's really good. And then we've got Lisa. My dog's very active, and I suppose that's what people sort of, what do I do if my dog's so, active? Will he stay still in a session? Find dogs that sort of just come in and settle down, or, I suppose each dog is so different, aren't they?
Yes, they're all different, and you've got to treat them individually, obviously. Most dogs are absolutely fine, and even the ones where people are really worried about, they do amazingly well. The ones that are sometimes a bit of a difficult ones are the young dogs, and we do get young dogs with arthritis, and we do get young dogs with ligament problems. So, you do get very commonly boxers with a ruptured cruciate or something like that. And that can be a challenge, but I work together with the owner. Mm-hmm. I don't, make the owner go out or anything like that. They can cuddle the dog while I am there. We might use just a few needles to start with, see how the dog accepts it. I haven't had to sedate a dog yet to do acupuncture on it. Mm-hmm. Now, that might be because people that get their dogs to come to me for acupuncture do look after their dogs. The dogs aren't usually very nasty. They're not very horrible. So they're much better looked after and part of the family. But if there is one that is really nasty, what I do use is maybe not start with needles. And that's something I might use in cats as well, because they're a bit more sensitive, is use laser acupuncture. And it takes a little bit longer because you do each point at a time and that sort of thing. But I've got a laser that just goes onto the individual point. It's very relaxing. The dog gets to know when it comes in. It's not painful. It actually feels quite well. We do often use some bickies or whatever we need to use, a bit like you will do as well.
Yeah.
To treat it. But it's amazing how many cats I get to lie down on the consulting room table and just take the acupuncture for 10 sessions after 2 or 3 sessions.
Yeah, because I think obviously that, if they're feeling better after it, or, when you're hearing it, then, they're going to be like, oh, I can do this again. And especially if you get some little bickies.
Yeah. And considering I work mainly from the vets, so they do see me in a consulting room, the people come in. I have got one dog coming in and he says, well, he knows exactly what time of the week it is, or every 3 weeks or 4 weeks. And he sits and waits for the lead to come to the vets because he feels so much better afterwards.
Yeah.
So they do think that it is a relaxing sort of thing, obviously.
And sort of how many sort of sessions do you do? Is it sort of like, start off weekly, or, obviously each case is quite different, but sort of how many sessions are you looking at?
Yeah, each case is completely different, and it depends whether it's an acute case or whether it's a chronic case. If I have got a chronic arthritis case or hip dysplasia, something that's been going on for quite a long time, what I tend to do is obviously do one intense session to start with. Now, the acupuncture might not be long, but a good workup, that sort of thing. And then I tend to see them weekly for 3 weeks. And then see what response we're having, what level of relaxation, what level of walking we've got back to, and that thing. And then start reducing the acupuncture and maybe put in some other modalities, whether it's hydrotherapy, whether it's physiotherapy, whether we start reducing medication a little bit. So just playing around with different things and seeing what suits the animal. And some dogs come back after every 4 weeks, if they're really quite late on and need a lot of support. And some dogs come back, if I get them early on in their sort of stage of arthritis, twice a year as the weather changes, when they often get worse, and get a top-up of the session.
Yeah.
And that keeps them going for quite a long time. But I tend to get people to then ring me, text me, say, oh God, we're just going slightly downhill again. We'll do one top-up, and often that's enough. If I get an acute case, say cruciate rupture or an intervertebral disc disease. Suddenly the disc has exploded, are very painful, doesn't want surgery at the moment. Or the other thing that I get quite often is cats after a road traffic accident that they might have a broken pelvis. Not much I can do about that, but their bladder function stops as well. The nerve that uses the bladder, innervates the bladder, stops, so they can't pee anymore. But if there is a bit of the nerve left, acupuncture can get that going again because it's nerve generating. So in those cases, I might do, well, the bladder cases tend to be in hospital anyway, so I do them daily. But intervertebral disc disease, I might see them every 2 days for a week and then space it out to weekly. After 2 weeks, you'll know they're either going to get better or they need surgery. And then you work it from there. And then they might not ever see me again after that, if it's repairable and if it gets better. So that's roughly what you're looking at. Again, after chemotherapy, we do get few dogs in now that have got chemotherapy. You know, at the beginning, when the dog's getting used to it, the nausea is a lot worse than afterwards. So you start with a few sessions and then you might stretch it out, you know, depending on how the dog's feeling.
Yeah. Oh, that's really good. Excellent. So I suppose we've just talked about intervertebral disc disease. So I was just sort of asking, he's on pain medication, so what, you know, anything else I should be doing? So there's quite a lot of things that you can be doing.
There are quite a lot of things. The first thing is strict rest. Strict rest. For intervertebral disc disease, strict rest for at least 2 weeks. And that means cage rest and literally taking out into the garden, carrying out if possible, if the dog's small enough, and it is often small dogs, letting it pee if it can still pee very well, and do his business and then get back again. And you can start with acupuncture at that point as well, and I do get quite a few. So if it is acute, that's what you should be doing. Pain medication, rest, acupuncture if possible. X-rays might not show very much at all. Often it is, if it's really severe intervertebral disc disease, that means paralysis, bladder isn't working well, so it's leaking, it's incontinent, or it's not peeing at all, then you need further investigations and you need a specialist. But those would be the first things. If it is intermediate, that means they might not be walking as well. They might be knuckling their hind legs. They might have a bit of poo falling out of their bottom because they don't recognize they need to go to the toilet very quickly. And then you might use pain medication. You might use reduced exercise. You might use a bit of acupuncture. But then hydrotherapy would be the one to use as well to get the hind legs strengthened so you don't get the muscle loss, which is so important because they need to keep their strength up.
Yes, they do, definitely. Yeah.
So definitely in those cases, you should be using quite a lot of different modalities rather than just pain medication. Yeah,
and I suppose it's sort of, getting to know that they are available to you as well, because obviously Chris asked, how do I know if my dog needs acupuncture? So I suppose it's asking the vet those questions as well, and just having that open conversation of, right, well, this is where we're at now. What other opportunities are there for me, to do for my dog? So is acupuncture?
And that often, unfortunately, still has to come from the client. Because as we see them at the surgery, and I'm in the same position, I have 10-minute appointments.
Yes.
In which time you've got to say hello, you've got to get friendly with the dog, you've got to make a diagnosis, you've got to make a treatment plan, you've got to get your medication. So it can be very, very rushed.
Yes.
And I often get people to come back or ring them later on and sort of discuss further things. But a lot of vets haven't got the time. They then rush out on visits or something like that. So it's asking the questions. Very important.
Yeah. And I suppose, as owners, it is important, ask all of those questions and don't be afraid to say, oh, well, can I come back for another appointment, like a
Yes.
follow-up appointment. Just go, okay, well, I didn't get to talk about this. Can we talk about this now? Or even just having like an email sent to them with some questions
Yes.
so that you can prepare, to answer those questions back, or maybe they can even do it via email so that it saves a bit of time, in that 10-minute consult as well. So just having those opportunities available. But, we're always available as well to chat, and, I'm sure you're available on the phone as well, just to say, is this an opportunity, is this right for my dog? And then go from there as well, which is always quite good. But as you say, it is sometimes a lot of the owner's initiative to know what's out there, and it is hard for owners to know what's out there as well, because trying to find that information through everything, and your poor little doggy
yes, and you're panicking, you're worried at that time, and the internet is full of information. Not all of it is very good.
Well, that's the other thing, is it's what there is a lot of information out there, and sometimes it is a bit overwhelming because emotionally you're overwhelmed with your dog. And then you're getting all of this information from the internet, and everyone's if you put on a post to say, oh, what should I do? A lot of people that have opinions, but I suppose it's just sort of, really thinking about it and talking to your vet about that and saying, okay, well, these are the things I've been thinking about, and, finding out and visiting a few different places as well. So going to, talking to a physiotherapist, talking to the hydrotherapist, and talking to your, it's building those relationships as well.
That's right. Yes. And I've now been in this area for a long enough time for all the vets to know me as well. And they often will tell people, just ring her and talk to her. And then I'm the one that, pushes people into this, that, or the other direction, really.
Yeah. So it's good to be able to, link together as well, which is really nice.
Which is what we should all be doing much more, but,
But it's time though as well,
It is time.
Because you still have to come and see my pool.
I do. I know. It's time.
It is. We've got the time now. It's just I'm not open.
Yes, that's right.
We'll be back soon, I'm sure. So
I think we're all looking forward to getting back to normal.
Yeah, definitely. So how does anybody get hold of you?
Right. Well, a lot of people just ring the surgery, and I work in Beverley and Hornsey at the Peel Veterinary Clinic. Which they're quite happy to take phone calls and then either task me with ringing you back or leave me a post-it note, and I'll give you my mobile number. I'm always reachable on my mobile number that you've probably got as well. It's holistic veterinary care, so
I can put your website link in the comments below.
I haven't got a website. I'm not that advanced.
Right, work on that.
I should get around to it. I know once the kids are gone, and that's only another year or two, I will be pushing that site much more. At the moment, I'm just, people ring me and that's it, sort of thing. But through the surgery is probably the best bet. But I'm happy for you to have my phone numbers out as well, and people just to ring to ask and chat and find out what it's all about and whether it would help or not. And I'll be quite happy to say yes or no, because there are some cases where acupuncture doesn't help, or whether it's not the right modality.
No, that sounds really great. Oh, thanks so much for that. That was amazing. Loads of information there.
Sorry if I've overloaded you. It's just such a vast subject as well, and it's 1,000 years of things that have been out there, and you could just keep going on about acupuncture for hours on end, really. Or I could anyway. I'd bore anybody else, but
no, I think we're going to have another chat.
That's absolutely fine, about certain conditions or whatever. That's and working together, how you do that, how you rehabilitate your cruciate dog, your back problem dog, that sort of thing is always no problem.
Amazing. Right, we'll be back together real soon. All right, thank you.
You're welcome. Take care, everybody. Bye.